Hi, I'm Degé Coutee with Patient Advocacy Network at cannabissaveslives.org, and this is your weekly installment of the Compassion Flower Report. Thank you for being here to get into what's going on today. First, I just want to thank Debbie, who reached out to me, a patient here in California. She wanted to tell me her story about accessing cannabis here under the new rules. And we talked about, again, it's another patient who's not utilizing our regulated system here in California for accessing cannabis. And we talked about that. And we talked a lot about compassionate care. And when I spoke to her over a week ago, actually exactly a week ago, we weren't sure what was going to happen with the compassionate care bill. It was a little over a week ago. And so now what I'm happy to report, and again, if you are a patient or provider anywhere in the United States and you have a story to share about how well or how poor your medical cannabis program is working in your community, we'd love to hear from you. We want to hear your story. We want to be able to compile this knowledge, share it with others, so that we can have the best medical cannabis system possible and lead by example here in the United States. So the big news here in California is about compassionate care. SB 829, it passed, which is good news. It's the good news is that it passed and these licenses are going to be available. The bad news is this bill is still not written to accommodate someone like WHAM. I read a little bit longer story about them, so if you check out our previous episode to this one, you'll learn a little bit more about the Women's Men's Alliance for Medical Cannabis, for medical marijuana, and about the history of that organization, and how they want to just be purely a compassionate care facility. This bill, and I'm going to read little pieces of it, just some sections that I think are really important for people to know. But this is going to allow specific license holders to be able to give marijuana away again for free. And this is a wonderful development. And here's why, and you'll hear from the legislature themselves why they find this. And so section 1, the very beginning of this bill reads, the legislature finds and declares all of the following. It's just 3 quick points. This act intends to regulate the distribution of donated medical cannabis, medical cannabis products by retailers and compassionate care programs, which were driven to the black market after the legalization of adult use cannabis. So they're recognizing that those who were poor and getting it for free had to find other ways to get it after Prop 64 passed. Compassionate care programs donate medicinal cannabis and cannabis products to patients with a valid physician's recommendation who need these products to treat their debilitating symptoms and heal. It is vital for the health and safety of vulnerable and low-income medicinal cannabis patients to keep them off the black market by allowing these compassionate donations. Keep them off the black market. Hopefully the people aren't on the black market. Hopefully it keeps them out of using the black market. And just FYI, I was informed by some colleagues of mine in South Central Los Angeles that black market is a racist term. Just putting that out there. You'll always hear me refer to maybe the underground or the unregulated market after I got schooled about what the black market really means. Quick section, just a couple sections. Again, this is what's added to the Business and Professions Code regarding compassionate care to provide access to medicinal cannabis patients who have difficulty accessing cannabis or cannabis products. A licensee that holds a Type 10 Retailer M license, a Type 9 Retailer Non-Storefront M license, and a Type 12 microbusiness. So if you have a storefront dispensary, a non-storefront dispensary, or a microbusiness, and you have the M licenses for those types of businesses, this will allow you to be able to provide free medical cannabis products to medical cannabis, and it says to medical cannabis patients, and it says if all the following criteria are met. And the criteria is mainly tracking. They want to make sure that the free cannabis that comes in is tracked, it goes out is tracked, the patients that are getting it are tracked. So from what I can tell from the way that this bill was finalized, the final edits of this bill, that the main thing that the legislature is concerned about is making sure that they haven't created any tax loopholes, and that the cannabis can be thoroughly tracked. I think they're afraid that by having a program where cannabis can come in and go out, and it's all part of a donation program, that it's not slipping through the cracks somehow. It hasn't as of yet, to the best of my knowledge, with compassion programs, but this is our legislature. And then this one final section, what's being added to the Revenue and Taxation Code on or after January 1st, 2019, the storage, use, or other consumption in this state of medicinal cannabis or medicinal cannabis product shall be exempt from use tax in either of the following circumstances. So they're going to eliminate the use tax. Again, they describe the circumstances, and it has to do with paperwork and transparency of who can be, how the product can be exempt from the use tax. And then the very final item on that, item F, it says this section shall remain in effect only until January 1st of 2024, and as of that date is repealed. So I don't know. I really want to find out more about why the state legislature thought to put a sunset date on this particular provision. Maybe the state legislature is going to cure cancer or solve the issue of poverty by or before January 1st of 2024, but we'll learn more about that. To jump in some of the news headlines that I thought were important to kind of demonstrate where the mood is right now with medical marijuana across the country. This was in a journal called the Medical Press, and it says new Illinois law allows medical marijuana pain prescriptions. Doctors in Illinois can now prescribe marijuana as a painkiller thanks to a new law intended to counter a growing opioid abuse epidemic. Now, I don't know if this is a error on behalf of the person who wrote this. If you've ever looked at a prescription pad sitting in your doctor's office, there are certain codes and language on that prescription pad that come from the DEA and the United States Department of Justice. Being able to write a prescription is not a privilege provided to you by the state. Being able to write a prescription for a controlled substance is something that gives you is under federal guidelines. So I don't know if they're meaning recommendation when they say prescribe. It's an error that is made often, but I still find it interesting. Carrying on here, the Republican governor, Bruce Rauner, signed the bill into law Tuesday, allowing physicians to temporarily prescribe cannabis for pain relief effective immediately. And here's kind of the why for that. The Illinois Department of Public Health reports that 11,000 people have died from opioid overdoses since 2008. And it says in 2016, opioid abuse killed nearly twice as many people as traffic accidents. I don't know exactly where that statistic comes from. It doesn't say if that's a national statistic or another statistic that comes from the Illinois Department of Public Health. It's a little unclear. So the law, it says the law creates a pilot program which includes safeguards against abuse. The bill that passed was SB 336. So again, equating that cannabis can help with opioid abuse and addiction and save lives and be an effective pain reliever. This story is out of Utah. If any of you have been following what's been going on in Utah, the citizens there gathered enough signatures to get an initiative on the ballot. It's contentious. There are opposition groups that don't want this bill to pass. I think they're real concerned about it. And so this out of the Deseret News, our Utah governor says he'll use bully pulpit to to get lawmakers to act on medical marijuana. Salt Lake City Governor Gary Herbert said Thursday he wants the legislature to take action on medical marijuana regardless of what happens in November with the proposition on the ballot. I think I'm in a position to get this done, Herbert told reporters after the taping of his monthly news conference on a local news station, promising the use of his office's bully pulpit to come up with a compromise lawmakers will pass. So he's trying to get something to pass. Interestingly, I don't know if he's going to be able to get something all the way through the legislature between now and November when this ballot is on the when this initiative is on the ballot, but he's pushing for it. It says during the program, the governor again said he will vote against Proposition 2, a citizens' initiative to legalize medical marijuana, noting most rational people understand there are some problems with the initiative that need to be fixed. He said lawmakers should be able to get behind a common sense position on using marijuana to relieve pain and suffering without promoting recreational use, including having county health departments serve as dispensaries. Legislative action will be needed whether or not voters approve Proposition 2, Herbert said. Proposition 2 is opposed by a coalition of religious, civic, business, and law enforcement officials that includes the Utah Medical Association, Salt Lake Chamber of Commerce, and the Church of Jesus Christ of Latter-day Saints. So it's gotten real contentious in Utah, and I thought Oklahoma would be more contentious than this, but obviously not. I really underestimated where elected officials and civic and religious leaders would fall on this. I haven't read Proposition 2 to know exactly why they oppose it, but I'm going to tell you the Patient Coalition is really out there. If you follow us on Twitter, you'll see some of the stories there. You can look just follow our feed and find the hashtag Utah, and you'll see. And a coalition of patients, especially parents with children who need medical cannabis, are out there in force. So it'll be interesting to see what happens in Utah in November. This story comes out of Oregon from the Statesman Journal. Liquor Control Commission seeks $7 million in pot taxes to track medical marijuana. If you've been following news stories here with Compassion Flower Report, the Oregon's Liquor Control Commission oversees all of the cannabis there, including medical. One of the problems the state has been having is basically a glut of product. And the last story I read out of Oregon was that the Liquor Control Commission was seeking to limit the quantity that a patient can purchase, because I think, again, it's that whole tracking thing. They don't want, I think they were concerned that patients were buying in bulk and then were able to turn around and maybe start a kitchen table business. So again, now that they want to limit the amount that patients can purchase, now they want to use recreational cannabis taxes to help them track medical marijuana. Legislators appropriated money to start the tracking program. This money would be ongoing funding. 23 positions have been authorized, which includes 16 inspectors. The head of the Liquor Control Commission said, our regulatory role over cannabis, recreational and now medical, as well as additional oversight responsibilities for hemp, has greatly expanded the work of our agency. Taxes collected on recreational marijuana sales are divided among a small pool of recipients that includes schools and the Oregon State Police. Oregon has brought in more than $180 million in state marijuana taxes since collections began in 2016, according to state figures. Under state law, the Oregon Department of Revenue is allowed to tap into marijuana tax revenues to pay for expenses associated with enforcement and administration of the state's marijuana laws. So, Oregon's got plenty of money coming in. They just have to deal with getting a balance between the amount that they're producing and the amount that the state can actually dispense within its own state boundaries. And a lot of that comes from what I've heard from people in Oregon is that the state issued a huge number of cultivation licenses, not really thinking about how much would be produced and how much could actually go out the door of storefronts. So it sounds, they're trying to figure it out. I would love to see state to state reciprocity. I'd love to see us get to a point where, we can take California cannabis over into Nevada, and, people in Nevada can have their cannabis in Oregon and Washington, all these states that have adult recreational and medical marijuana laws, when we can get to a point where we can spread what we're growing out and around the country. It would be wonderful. It's going to be a while, but I optimistic we will get there. This story is out of Massachusetts, ABC 5 News, WCVB out of Boston. A.G. Healy changes decision, says towns can't ban medical marijuana. This is an issue not just in Massachusetts, but all over the country, something we deal with here in California. We call them medical marijuana deserts. It's where you live someplace, like, you live in a state that has medical marijuana laws, but you live in a location in the state where all of the jurisdictions around you have decided to pass a ban. And it makes it very difficult for patients in those situations to access medical cannabis without having to take a long, expensive drive somewhere. Massachusetts Attorney General Maura Healey is reversing her previous decision that allowed communities to ban medical marijuana dispensaries. Medical marijuana was legalized in 2012, Massachusetts, at which time then Attorney General Martha Coakley determined that cities and towns were not allowed to ban dispensaries. Healey's office initially interpreted the new law as allowing municipalities to ban both recreational and medical pot sales. On Friday, the AG altered that decision and issued supplemental decisions to Northborough and Bellingham. The Attorney General's office is committed to ensuring that marijuana legalization law is implemented as quickly and safely as possible, said Margaret Quackenbush, Deputy Press Secretary for the AG. After further review, we have determined that under the statute, towns are not permitted to enact bans on medical marijuana establishments. That's good news. Hopefully that will be something that we see spread. At least the sentiment, you can't just change laws because, this is what they decided to do in Massachusetts. But it's good to see that, and I think that's really good movement for patients out there. This is an AP story that I found in the Sacramento Bee. Virginia to keep medical cannabis licensing process secret. Out of Richmond, Virginia, the state panel that will award Virginia's first 5 medical marijuana licenses will keep the application review process confidential. It says the Virginia Board of Pharmacy chair announced Tuesday that the 51 applications would be considered in closed session. That decision came after regulators conferred about Virginia's public meeting law. The pharmacy's board says the Attorney General's office also provided advice. Medical cannabis applications are being treated as medical license applications and are there exempt from the Virginia Freedom of Information Act. I wonder what it is they are so concerned about hiding. Is it the process? Is it the confidential information of the people who'd be cultivating and distributing? I don't know. I'm not sure why in Virginia they want to be so private. Of course, Arlington, Virginia is a big hub of federal government. We've heard in other states about, we know that John Boehner has gotten involved. I believe one of the licenses in Nevada for cannabis. There, there's a judge involved in one of those boards. Not that there's an issue with this, but just makes me wonder what it is Virginia is really concerned about concealing, such that they are going to treat the applications like medical license, which is going to exempt looking at these applications under the Freedom of Information Act. Story out of SF Gate. California's legal medical marijuana delivery services threatened by police and unions. This is another issue that's going on with the licensing in Sacramento and California with our bumpy transition into legalization here. Alliances, trade associations have gotten together in Sacramento to push for having statewide eligible delivery services, and there are rules and regulations in place for what they refer to as non-storefront. They still have rigorous regulatory process for delivery services. However, as you hear here, they're threatened by police and unions. A group of California police chiefs have launched a campaign to stop Californians from obtaining legal cannabis from delivery services. The California Police Chiefs Association have joined the League of California Cities and the United Food and Commercial Workers Western States Council in creating a website petitioning residents to ban marijuana deliveries outright. So we're talking about getting rid of the entire license, the non-storefront license altogether. And so the head of the UFCW, this Western Council that they mentioned in the story, he says that regulated marijuana dispensaries have tough security checks for identity and legal age and strictly licensed workers. If marijuana can be delivered anywhere with virtually no regulation, California will lose these safeguards. His name is James Araby. It just shows how ignorant he is, and he's just really speaking on an emotional level and not on an informed level. Listen on. Their website, entitled Stop Wandering Weed, depicts a group of excited children as a delivery truck pulls up to their school. Despite the baiting imagery, delivery services are still held to the same compliance standards as retail shops, meaning that a delivery made to a grade school would still be considered illegal. Little sarcasm there from our SF Gate reporter. The anti-delivery efforts made by these groups would go against Senate Bill 1302, proposed in May, which would provide Californians with expanded access to delivery services rather than fueling criminal sales. So important. Talk more about that. The premise of the measures ensure that the will of the voters to create safe access to medical and recreational cannabis is preserved and in some cases returned. Said Senator Ricardo Lara in a hearing regarding the bill. This measure is not intended to interfere with local government, a decision to abstain from or ban licensing or taxing regulating cannabis businesses. A report released in August found that 18% of the state's consumers have turned to the black market due to the lack of access to legal products. Banning delivery services altogether would likely influence even more illegal sales. I'll read that again. Banning delivery services altogether would likely influence even more illegal sales. Yes, absolutely. If you are a medical marijuana patient and you live in a medical marijuana desert and there are no dispensaries around you, but you can call a delivery service that will come and serve you, and it's regulated and the cannabis has been tested and you have someone to talk to, and I've looked at jobs for these delivery services, and some of them, they're very patient focused. They let you know that you're going to be doing a little consulting and meeting with patients, and they don't want just somebody who's going to act like an in-out food delivery driver. They say in the job description that they want you to have some compassion. They want you to be someone who's willing to spend a little friendly time with some of these patients, and that is beautiful for lower income, homebound patients to be able to get that service, to have that connection. I can tell you from working so many years working with patients and working inside dispensaries with patients, even if it's just someone coming in to provide education, training, peer counseling, not necessarily being an employee of the dispensary, but being a nonprofit organization providing services to patients at dispensaries. Even the sickest patients, they might not want to go to the grocery store. They might not want to get over to the gas station. They might not want to hassle with the bank. But for the most part, patients want to go to dispensaries just for the interaction and talking to somebody who understands them, a place where they're not going to be judged for their cannabis use. However, as that gets more and more difficult, as the price of gasoline goes up, as patients become more ill and need to be at home more often, to know that you can have a medical focused delivery service come to your home is a wonderful thing. And then as compassionate care kicks in, that a delivery service will actually be able to hopefully afford to send a delivery driver to somebody who's not going to pay, that veteran who's just having a really bad day and can't get out and wants somebody from that non-storefront dispensary to come for a visit. Let's make that happen. That's the next thing to see happen in our compassionate care circle. This last story, talking about veterans, this is out of Forbes. It says Senate bill would legalize medical marijuana for military veterans. 2 Democratic U.S. senators filed legislation on Wednesday that would effectively legalize marijuana for military veterans and let government doctors help them access it. Under the Veterans Medical Marijuana Safe Harbor Act, Department of Veterans Affairs physicians would be empowered to issue medical cannabis recommendations in accordance with the laws of growing number states. The legislation, sponsored by Senators Bill Nelson, Democrat from Florida, and Brian Schatz, maybe Scatz, Schatz, a Democrat out of Hawaii, also makes it legal under federal law for military veterans to use, possess, or transport medical marijuana in accordance with the laws of the state in which the use, possession, and transport occurs. And it requires the VA to conduct studies on the effects of medical marijuana in veterans in pain and the relationship between treatment programs involving medical marijuana that are approved by states, the access of veterans to such programs, and the reduction in opioid abuse among veterans. The bill allocates $15 million for the research. So they actually want to see how effective cannabis is for veterans, which I think is wonderful. Over the last maybe 5 to 7 years, we've seen the Senate and the House of Representatives try to put forward VA bills around medical marijuana that they just always fall flat. So I think this is one to take a closer look at and probably get involved with. I've known a lot of veterans to be denied benefits, to be denied treatment by the VA, to be chastised by doctors for using medical cannabis. So we need to end that. This is another call for compassion to let our veterans have access to medical cannabis and feel safe about it and not have the VA chastise them for it. Actually, now we're going to see the VA research this and VA doctors be able to write recommendations. So that's really good news. So that's just a little bit about what's going on in medical cannabis news, just a little slice of information. Of course, you can go to our new website, cannabissaveslives.org. It's our same domain name. It's just a refreshed site. And you can sign up for email updates there. We will send you alerts about what's going on. Of course, please check out our Twitter page at Pan for Compassion. We post headlines there regularly, as well as our other social media. I want to thank you for watching. I'm asking you to please donate to the Patient Advocacy Network. We're a charitable 501c3. Your support is tax deductible. You won't see a Patreon account associated with this channel. We have our donate button on our blog as well as our website. Cannabis Patient Voice is our blog on Blogspot. Our website is cannabissaveslives.org. You can click either of those donate buttons, make a donation in any amount that's right for you. It's tax deductible. You will get a tax deductible receipt. Our organization is most effective when you make a monthly donation. So when you click that donate button, you can choose a monthly amount that's right for you. And again, you'll get a receipt for each of those donations. Please like and subscribe here at our channel. I'm Degé Coutee, and this has been the Compassion Flower Report.